it irritates the sciatic nerve. So that's L45S1, which Dr. Whitney just injected. You have pain here at the common peroneal nerve as the nerve goes around the fibula. When I press on that, you have pain. So that's the double crush syndrome we talked about yesterday. So when you relieve one pressure or another one, and then the flow inside the nerve starts again. 16% of the people have diabetes or sugar as a cause. So that's the background of that. And that was Upton and McComas, 1973. I knew him well. No, I didn't. Okay, you're going to feel a little stick right here. 1, 2, 3. Okay. Here we are with Dr. Tom Wall, good friend of mine. He has an MD and a PhD in exercise physiology.
Yes, sir.
Do you use it?
Every day.
Every day. So we're going to talk about stem cells, biologics, posture, physical therapy. You're an expert. So let's take a typical patient that, like you just saw, you had an accident case, very stereotypical patient, 26-year-old, shoulder and elbow problem.
Right.
You use PRP. Tell us why you picked that.
Well, first of all, PRP is something that's easy to obtain. It's not expensive versus using, going in and using someone's stem cells, like from bone marrow or so forth. So the ease of use is number one, and its efficacy is the second reason why. We find that it works well, and it's my opinion that you've already alluded to, that PRP will recruit stem cells, will recruit your stem cells to kind of do what they need to do and have healing type effects.
Right, and they work through these growth factors. Now, you just said it, they're over 1,200, so you're ahead of me on that one. I thought we were around 1,000, so that must have been 2 weeks ago.
Yeah, there are quite a bit. There are quite a bit.
So those growth factors, they all have names like VEGF, vascular endothelial growth factor, brain-derived, et cetera, et cetera, et cetera. So I always tell my patients, these are like construction workers. You have damage to a building, there's a fire, you need to pull out the drywall, put in new plumbing. That's what these growth factors do. They get in to try to repair. Now, actually how that happens is hard to determine. That's where the research needs to be done.
Right.
But in our experience in the last 15 years, this helps a lot of patients without surgery. And we're both surgeons.
Yeah, exactly.
And we're trying to stop or trying to prevent a surgery that doesn't need to be done.
Right. And the clinical outcomes are way ahead of the research. And there lies the problem, because 10 years ago, we had people coming in asking for stem cells. They go, I want stem cells. It's like, where'd you hear about that? And their friends had it or so forth. So people expect it to get this kind of product. So if you take a look at Google and see how often the word stem cells is looked up, it's significant. They get tons of clicks on this stuff. So the folks in the community, they're well educated on knowing that the stuff works. It's just that we a lot of times don't know why it works. But right. even the products that were taken off the market, people had good results with it. It's just that the problem was we don't have the science behind it just yet.
Right, and we're working on those protocols. Now we have 15 years of experience, and we're getting these protocols better, faster, easier, and in a lot of cases cheaper.
Right.
So I'm working right now on how can we extend the effect of any of these cells to make them more viable and potent. So 15 years ago I was using lasers, very expensive, but they emitted a red light, near infrared spectrum around 1,000 nanohertz, specifically about 880. Now LED, red light therapy, is getting big because the prices are down.
Sure.
So it does bring more nitric oxide to the part. I'm also trying to come up with some supplements that will extend the efficacy of the stem cells that you have left, and some creams and potions and things like that. So when people come in and they say, I have knee pain, let's talk about knee pain because that's so big. Knee pain, I'm going to give you a patient, a 50-year-old, active and still involved playing tennis. Pickleball is a big one. He's got knee pain. Your MRI says the cartilage is intact but worn. How would you treat that patient?
Well, the first thing we do is we take a look at their biomechanics, okay, to see how they're transmitting their force through their body. A lot of times, their knee is being overpressurized by problems in their feet or problem up in their core, and that's a big problem. So you need to pick that up first before you try any kind of regenerative techniques, because if you don't, your results are not going to be as good as they would if you correct underlying problems. I learned from you a long time ago about the nutritional aspect, and you're one of the leading figures in the country, if not the world, on how bad sugar is for you and how it creates an inflammation. Can you expound on that a little bit?
Well, I'm actually just writing a new book because patients come in and they say, well, I've been on sugar for 50, 60, 70 years. It's difficult to get off of it, and I appreciate that. So I try to change their diet, at least to a keto. Sometimes I suggest get into a carnivore diet, no carbohydrates, no inflammatory, and then gradually add back in what you think you can tolerate. I think supplements are excellent, but we need more work on that, the LED we just talked about. But fundamentally, most of these inflammatory diseases are caused by sugar.
Sure.
So in my new book, it's called Unglued. And I just learned this myself a year ago when I was in a think tank, and the producer said, well, what does the word glucose mean? I said, well, it's a simple sugar. No, what does the word mean? I said, what do you mean? I don't know. So I had to look it up. Glucose means, a Greek word, means to adhere, to stick together. It's glue. That's why it's called glucose.
Yeah.
So the book is Unglued. How do you get unglued from these inflammatory diseases? So we just discussed all the things that we know in the regenerative world. And if they don't work, then we do the surgery.
Right.
And the biomechanics for sure. So that's how we approach modern medicine. As the levels of ADMA started to go up like that, I saw other neuropathies like multiple sclerosis.
Yes.
And other things. So I'll just concentrate on MS for the moment.
Yeah.
So I showed this to Dr. Cook. It was probably about 2008. We were at an MS meeting. I said, Dr. Cook, look at this. And I remember he says, quit your practice, work with me full time. Well, he's a scientist. So, but he's a cardiologist by training. And one of the questions I asked him when I first met him, because I always thought this was odd that cholesterol was the culprit, the bad guy.
Right.
So, but I didn't want to offend him. So I said, could you help me understand the cholesterol hypothesis, which is fundamental to this whole story? So he said, the lining of the blood vessel, which is called the endothelium, is like Teflon, smooth. When you eat sugar, it makes it like Velcro. And it sends a signal out through the blood to the liver, and cholesterol is a signaling molecule that goes to the area of inflammation and seals it off, and that's what we call plaque. So cholesterol does not cause the disease, it's trying to heal the disease. Sugar is the culprit. So in that framework, we started to dive into all these different diseases.
But in general, we are told something different than you were just saying.
Oh, still to this day, it's
Still
different.
to this day.
So
Totally.
statin drugs, which lower your cholesterol, is $1 trillion drug. Follow the money. So they kind of shut that down. So we went down to Panama with Dr. Briggs. We have a couple of NFL players here. He looks like the guy on that Netflix, Elliot. Yes, you do. Every time I look at you. Yes. Yeah. So let's take ALS. 400% higher prevalence in the NFL. Do NFL players eat a lot of carbohydrates? They have to get to that weight. Do they have trauma? Do you think maybe? that nerve, let's define that word. Amyotrophic lateral sclerosis. A in Latin means no muscle function on either side of the neck. The specific nerve is the glossopharyngeal nerve, which allows you to swallow. If you can't swallow, the fluid goes in your lungs and you die. And it takes about 15 months. And there's no way out of that. So, trauma, my theory is trauma plus sugar equals nerve dysfunction. It doesn't matter which nerve it is because carpal tunnel, the median nerve, muscle function. Muscle function. So I don't know if you know the EMF thing with phones, but a phone is a microwave oven, basically. So the longer the wavelength, the poorer the communication and the slower. The 5G is a pulse wave. So it's like putting your head inside that microwave and have sugar in your mouth, turn the microwave on, the cell phone, and you're gonna just blow it up. So his theory is that if a nerve will discharge 7 million times the calcium ions out of the nerve with 5G. 7 million times. So everybody, and we're all kind of sloppy on this, should have Faraday cages around our phones, and we should have lots of things to counteract electromagnetic fields. So if I'm right, electromagnetic field is a trauma plus sugar equals nerve dysfunction. And that's why we have the prevalence of glioblastomas, but that's a whole other discussion. There's another really interesting story from an Australian doctor. He's a neurosurgeon talking about vegetables are out to kill you. And he's into the carnivore diet, and he's actually right. All vegetables have a poison in them, and he explains it this way. Animals can move away from danger. Plants can't. So they have like cactus. They have thorns, rose bushes, thorns, poison ivy. Well, you'll get a rash. But Brussels sprouts and kale and things that we think are safe are not. They cause irritable bowel, cause disruption of your intestinal tract. Those proteins leak into your system, and they're really not good for you. Human beings are carnivores. I discussed this with Don Johansson, who happens to be here. And he invited me to a lecture in New York City years ago. What did Lucy eat? If you believe Lucy is the first primate. She was a arboreal being, and when she got out of the trees, then she ate bugs, then fat, meat, cooking meat, and here we are. It took 3.2 million years. So I'm not sure that theory is correct. I think there's been genetic modifications along the way, and some are sinister. That's my new book, Original Sin, Hacking the Human Genome. Yeah.
One of the things that I'm concerned about is we have 70% more sugar inside of our diets because of the meat industry. We have genetic modification, we've got MSGs, we've got GMO, we've got all these things inside of our environment. Is it just the sugar, or should we be concerned about sugar, glyphosates, all the other poisons and toxins?
Yes. So, Stephanie Seneff, top scientist at MIT, she helped me understand the sugarmate pathway. I'm not sure, we never had that in school. But let me see if I can make it simple. She's got like 3 PhDs. She wrote me a letter when I was on my way to Costa Rica. I'll never forget it. I think every other word I didn't know. Okay, and it was a long letter. So I had a dictionary. I'm trying to figure out what she's saying. She's a physicist and a biologist. Here's how she explains it. When Monsanto got permission from the FDA through their studies that glyphosate did not affect human beings, and it didn't directly, but it did affect your microbiome, which is the bacteria. So glyphosate, as the word says, the GL portion is glycine. So they took lysine and attached a phosphate to it and stuck it in the genome. So when a plant is sprayed with glyphosate, everything dies except for the genetically altered corn product or soy product. So it doesn't get affected. Everything else does. However, when you eat that product, it has glyphosate, and it gets into your microbiome. And this is the experiment that I wanted to do, which I didn't get a grant for. So there are about 1,000 organisms in your gut. So I proposed that let's see which of those organisms love glyphosate, and we can eliminate them. And I could tell by putting sensors on a sensory nerve or a motor nerve and see if the amplitude went down with certain bacteria and they went up with others. So I would want the good ones and not the bad ones. That's when I got, really? Yeah. Because what I said was correct, but I didn't get the grant. And the person in the audience, like this, I didn't know it, is the director of Monsanto and raised $300 million for the institution I was at. Of course I didn't. I did a deep dive on him. He's a virologist by training. Started as a veterinarian out of London, part of this Davos group, the World Economic Order. He's on that as well. And his good buddy is Fauci. What a coincidence, yes.
Did you know that the president and CEO of Pfizer, Adam Bourla, is also a veterinarian, trained in the study of fertilization of sheep? Let that sink in. That's our person that was telling everybody they needed to be vaccinated.
Correct. And our past surgeon or head of the FDA, Scott Gottlieb, is on the board.
Yes.
I call him a clairvoyant because 3 years prior to getting on the board of Pfizer, he just knew he would land there.
Oh, also, Doctor, you also know about Veritas and the undercover camera study they did about the vaccinations and so forth, but they were bragging about how they have people from different pharmaceutical companies doing, basically it's an open revolving door from government officials doing oversight to go to pharmaceutical companies and back again. So that the overseers are the ones working for the pharmaceutical companies and have a place to land.
It's almost 100%. Yeah. So the fix is in. People like us who are trying to get the message out, and that's what we have to do. But we're putting ourselves at extreme risk in all the countries because they run the country, and that is the deep state. Yes?
I was writing a book series back in 1993 with an applied kinesiologist named Carolyn Finch, and we went very heavily into sugar. We went heavily into all the aluminum in the foods, the everything else that's causing the cancer, that's causing this and that. The medical world would not let us put the book out, by the way, in 1993 because it would have saved, 15 more years of women not getting breast cancer because they're not, putting the Under Armour, it clogs up in their bra and that gives them blah, blah, blah. But they don't want to help us. I mean, obviously, they don't want to help us. And I thank you for everything that you are doing to help us, Doctor, very much. The only one thing I might just suggest, Dr. Richard Leakey is, you all know him, I'm sure, was a paleontologist and all that, and he was behind gave a lot of the support to Darwin, saying that we came from Lucy, as you said. On his deathbed, because he was so upset that he had lied and put false things together to make it look like we came from monkeys and Lucy, he wrote a book called, it was called, Origins Rediscovered.
Yeah, so I know people who knew Leakey, who were on that expedition, Don Johansson. They never identified that link, fructose. Now look at this, here's a quick snack of yogurt, traditionally thought to be healthy, but look, fruit, all sugar, sugar. Roughly 2,000 calories, not a good snack. Chips, same thing, deceptive, 2,000 calories, loaded with sugar. Let's go over to other things. Sarah, nice to meet you.
Nice to meet you too, Dr. Jacoby. Thank
Well,
you
tell
for
us-
the invitation.
Well, it's happy to have you here. But I found out something about you today, that your coffee selection is not the best. So tell me about how you drink your coffee.
Well, I usually use honey, which I don't have today. So I use Keto Sweet, which is actually no sugar, and it's
But
no
I looked at this, Sarah,
Yes.
and on the back here it says
zero sugar.
it says 0 sugar, 0 carbs, but we have total carbohydrates at 8 grams. Total sugar is 16 grams. The real answer is 43 grams of carbohydrates. That's 10 teaspoons of sugar per serving. Okay, there's 6 servings here. 6 times, that's 90 teaspoons of sugar. Is that right? We're gonna take it to a new level.
Okay.
So we're gonna take some really good coffee, dark coffee, and I think you can pretty much any coffee you like that's strong, and we're gonna put
I'm more
some.
likely the milky coffee. You know, when I go to the Starbucks, I go always a caramel frappe,
We're gonna put a little bit of butter.
butter in a
Okay.
cup.
In the cup. You go ahead and stir that for me, and just to take you to another level, we're gonna put an egg in your coffee.
Can
Can you do it? Yeah, that's good. Okay.
I am not sure about it.
Well, let's put this egg in there, and we have to whisk it around rather vigorously because it'll clump up if we don't. So you see that egg in there?
I do.
Are you scared?
It's not about I don't think I'm mentally ready.
Well, a lot of people
It's just-
aren't.
it
You don't
just-
pass out easy, do you?
Okay.
Do you see any egg left?
No.
No. Okay.
It looks like my coffee, but I still see
It's a
something.
nice color though, isn't it? A little bit of butter.
Yes.
Take the challenge.
Okay. Okay.
Silky,
It is smooth.
smooth. Do you taste any?
I can taste.
You taste butter, but do
Butter.
you taste egg?
Not really.
All right, we have people who never had butter in their coffee.
I've had butter in my coffee, not an egg. But the shit got real when you put in the egg. All of a sudden, I'm
Okay,
like,
no. So we're going to put what you have in here, except for you, is a egg in the coffee with the butter. So on a count of 3, and I'll preface this a little more. You're going to drink the coffee, taste the coffee, and we want to see your expressions because that is kind of a ring of fire to go through. If you're used to coffee with cream and sugar, big challenge. You ready? On a count of 3. 1, 2, 3. Little trepidation getting there, but surprised? Yeah. So, who tasted the egg in their coffee?
do you?
I did because I got the whole egg.
You got what?
I got a little bit of egg.
You got a little bit of egg. Did you taste the egg? No. Well,
Now
you
you're
didn't have egg.
making me scared.
Did you taste egg?
Taste it. No, I didn't taste it.
Did you?
Slightly, but
Did you?
Super slightly, not really.
Super slightly?
Super slightly.
Okay. What was the texture of the coffee?
creamy.
Yes.
Creamy. Anybody use the word silky?
Yes.
Yeah, it's smooth. Takes that bitterness off. So why am I even suggesting this? To tell you that what you're doing for your diet is all wrong. The food pyramid is a fraud constructed by the United States Department of Agriculture. All this sugar on the bottom, no eggs, butter on the top, oils. That's why you're sick. That's why the whole country's sick. That's why they had the virus, because viruses love sugar. And they're going to get in your lungs to get the sugar and raise their family. And you die, they live. That's that simple. So this is a good alternative. Now, it's an acquired taste. I think you have to love coffee, but Mike who did the challenge, he did not like coffee, but by doing it this way, made the coffee better. Takes the rich, right? You want it's bad for you. Not coffee is good, but sugar's bad. Fat is good. Well, wait a minute. For the last 60, 70 years, we were told the opposite.
Of course.
And are we fat and sick, or skinny and healthy?
I mean, it's just like the food group. Look at the food group.
It's a total lie. I said, really, we don't have genetic diseases. We have epigenetic diseases. They are reversible. They're not immutable. But the question is, what happened to these twins that one had stem cells? Well, they lived. I said, what do you mean they lived? Well, this child is still alive. The one who didn't get the stem cells passed away. So this concept of stem cells works. We need to get it front and center for a debate. If you have a kid with autism or a serious disease that's not curable, then why don't you have the sovereign right to treat yourself? It's naturally occurring tissue.
My name is Karen, and I'm 68 years old, and I've known Dr. Jacoby for about 17 years. He spoke at our Sjogren's support group, and he's also been at our health fair. And the podiatrist I was going to retired, and he recommended that I see Dr. Jacoby, and I did. And he's been helping me ever since. I fell and chipped a bone, and he's done surgery on me. And he always makes me feel like he's interested in me and my problems. And the stem cell treatment was such a big relief because my feet are on fire. They're in so much pain. It's hard to walk, hard to exercise. You just don't want to do anything. If you prop them up too long, they hurt. If they're down, they hurt. So with the stem cell treatment, I have 5 years of relief, but it slowly wore off, and then the pain came back with a vengeance. I have Sjogren's disease, which is an autoimmune disease, and it seems like once you get one autoimmune disease, you pick up others. And one that I picked up was autoimmune hepatitis. It's not from drinking, it's not from drugs, it's just an autoimmune hepatitis disease. And I got the stem cell treatment for my feet only. And I went to my liver doctor, and I told her I was gonna, about having the stem cell treatment, and she was telling me, don't do that. That's experimental. And so I don't want you to do experimental medication. And I told her, oops, I already had it done. And she said, well, then I want to do blood work on you. And she did blood work, and she says, you're in remission, and I don't have to give you any medication at all. And I haven't been on any medication for autoimmune hepatitis for the last 5 years. All because of the stem cell treatment.
The associate vet comes in and he gets all emotional because this is exactly like the dog he had that had this myelitis, spinal myelitis, and his dog did the same thing. And so he nurtured that dog to its end and was very emotional about the fact that Lacey was there with the same condition. And so he literally came in and sat on the floor in front of us, like he camped in to tell us the story. So when he did that, he went through all the experience he had with his dog and, the disadvantage of letting a dog just die slowly like that. And the end thing was, the comment to Pam was, it would not be unkind to put her down.
It would not be unkind
To put her down.
put the dog down,
Yeah.
meaning down, meaning
Terminate.
terminate.
Yeah. So Pam was just all emotional, and it was horrible. You know, I'm looking at that moment on the door, a sign, stem cells, and I'm going, okay, where is this conversation? So then we got the stem cell treatment where you actually intrathecally inside the spinal cord area, he put the stem cells and did a beautiful job. Within a month, this dog was up and walking. Get emotional talking about it.
Well, you should, because of the seminal moment.
Yeah, yeah, good.
So it wouldn't be so unkind to put your dog down
Yeah, which we hear.
all the time with humans.
Yeah.
It wouldn't be so unkind to let the course of the disease take its step.
Yeah, keep you on medicine until your nerves die.
And it wouldn't be so unkind to amputate the leg.
Right.
But if you have this specialized knowledge, which you do, with stem cells and decompression, which 99.9% of the doctors in the world don't, and they would criticize us for trying to push the envelope.